there is another CESR equivalency for a GP practice, which is the CAGPR, which the number has stayed around the same figure, which is around 50 to 60 candidates. So my talk today is mainly about the CESR rather than the GP. So there is increased interest in people coming to the UK to apply through the CESR, as you can see. This is another pie chart for just the applications by specialties. As you can see, surgical and medical applications comply about 50% of the applications. I do apologize for the crumbling of the numbers here, but the rest of the specialties, anesthetics, pediatrics, obs and gynae comprise about between 7 and 10%. But the main bulk is the surgical and medical specialties. Okay, how do you apply for the CESR? As my previous colleagues were talking, you need to apply via the GMC online. So you need to have to register with the GMC. And when you have a registration, you will have something called GMC Online, which is like a personal account on the GMC. You go on this My GMC, you open your page and then start the application process from there. It's an electronic application, so you need to upload all your evidence electronically on the web page. Once you open an application, you must submit all the evidence within 12 months. So if you have an open application more than 12 months, after the 12 months, the application will automatically close and you have to open a new one. However, if you have saved anything of that application, that would be lost. So you need to make sure once you start an application, make sure that you finish it within 12 months, or make sure that you transfer all the documents that you have done it on the new application if you're planning to extend it over 12 months. The fees is about £1,676. I'm just going to talk a little bit about your CV. So the CV, as my colleague talked earlier in the first session, to apply for the CESR, you need to adjust your CV in a special format. The details of that format will be on the GMC website. I'm just going to briefly talk about it. So one of the main things that you need to make sure that the information on your CV must match the application. In terms of doing the employment history, you should start with the most recent employment and then work backwards. As my previous colleagues talked about the gaps, you should include any details of any gaps over 28 days. So up to 28 days is fine. If you have any gaps over 28 days, you need to mention that, and you need to mention what were you doing during this time. If you have any awards, research experience, publications, presentations, you need to put that all in your CV. Any audit experience, as I said, audit plays an important part of the practicing medicine here in the UK, and there's a lot of need for showing that you have participated and have done audits during your practice. Obviously, the continuous professional development CPDs over the last 5 years. So any conferences you have attended, any presentations you've done, all that you need to include also in your CV. Teaching and training, any management experience, all the procedures or types of operations you have done if you're a surgeon, all that you need to put in your CV. And obviously, any extra activity, you also need to include that in your CV. Before you apply, you need to read the specialty-specific guidance and the curriculum for the specialty. So when you go on the GMC websites, depending on the specialty you're applying in, whether it's gynae, surgery, intensive care, anesthesia. There is a specific PDF booklet or guidance on the GMC website telling you exactly what you need to do to be eligible to apply for your specialty. You also need to look at the curriculum, because there has been different versions of the curriculum, and you will be assessed against a specific version. So you need to read that curriculum well and need to understand all the points inside the curriculum, inside this curriculum, because this is what you're going to be assessed against. Don't duplicate your evidence. So instead of duplicating it, you can cross-reference. So I'll talk later in my presentation. If you have, there is a single piece of evidence can be needed in different parts of the application. So you don't need to keep repeating the same one. You can just refer to this evidence I have supplied, for example, in section 1 point so and so. So that's what you need to do if you have similar evidence that can apply to different sections. You need to make sure that this evidence you're providing is relevant to the question. As I will show you later, the application is very specific and asking specific questions. You need to be focused on that question. Don't provide any evidence just for the sake of adding in any papers. The application, the documents that you normally apply ranges between 800 to 1200 pages, roughly, the whole application. You also need to make sure that all your evidence is anonymized, as in all the patient identifiable data have been anonymized, name, date of birth, hospital number. You can't provide that, otherwise your application won't be assessed, and you might be referred to the GMC, and it's very important that you need to make sure that any evidence you provide have been anonymized. Submitting your evidence, as I said, it's an electronic application, so you upload all of that document. So you upload it on your application. Why electronically? It's faster, it's cheaper, and it's more secure. In the past, used to send all these documents by post. It takes time. There is a risk that some of the documents might be lost. Imagine sending a booklet of 800 or 1200 pages in the post and waiting for that to arrive in the GMC. Nowadays, it's much easier and safer to upload things electronically. As I said, the online application is open for 12 months. The advice on your application will be on the GMC online. So you'll have correspondence, emails with the GMC, and then you'll have all the updates on your specific online page when you register with the GMC. As I said, each specialty will have a different application form. So this is a snapshot of how the application will look like. If you look at the top here, so this is the areas of competence that you need to demonstrate. I'll talk later about how is the assessment done. So it's done across 4 domains. So the first one is what we call the knowledge, skills, and performance. As you can see, so the summary of what you need to show, you must provide an up-to-date copy of your CV, which include details listed on the guidance. And here, this is the evidence that you provided, and it gives you a clear instruction of what your CV should include. And then this section, this is the one you're uploading. And then, as I said, you can edit, add, or delete any sections. And then once you upload this document, this evidence will be ticked as a green and already uploaded. And then in this section, you will have any remarks from the GMC when they review your application. You'll have anything mentioned in that section. So this is just one part of the application and how it looks like. In terms of the application process and timeline, so once you've submitted your application electronically, the GMC will do an initial assessment in the first 5 days. and then it will, and then over the next 14 days, you should send a hard copy. However, having said that, the GMC at the moment are not accepting any hard copy because of the COVID situations. So after the initial eligibility check, the GMC will contact the verifiers whom you should name in your application and ask for a structured report from the verifiers and the referees. The next step would be once the evidence have been received, the GMC specialist advisor. So when you apply online, so the GMC will allocate a specific person who will be responsible for your application. He will send you an email saying that he has received your evidence and he's currently reviewing it. He will have this advisor will have initial 30 days to assess all the evidence. Following that 30 days, he will send you an email with a checklist of what's his remarks or reviews about his initial check on your application. And then when you receive this initial checklist, it will be very specific. It will ask you, he will mention in that checklist what documents exactly has he accepted, what documents do you need to add, what documents are not accepted, and you will have 60 days to gather additional evidence and then resend it back to the GMC. So this is a snapshot of this initial checklist. So as you see, this section is the not accepted area of competence. So it will tell you exactly which domains they're not accepting the evidence. So for example, here is knowledge and skills. So this is the GMC advisor command. So they said, for example, here, the work history listed in your CV doesn't match the application form. It's one of the common themes of why the application got sent back. That you need to make sure that the history, the work history on your CV match the application form. For example, here they're talking about the research. Your research is too old. You need to consider providing recent evidence. The audit doesn't list your name. All the comments of the GMC advisors will be listed here. And this is another section where the areas of which they have accepted. And they said the status is accepted, the appraisal and workplace. So this is how it looks like, the initial assessment when the GMC send it back to you. Following that, you will have, as I said, 60 days to gather additional evidence and update whatever is in your list, and then send it back to the GMC. Following that, the GMC specialist advisor will assess the other evidence that you have sent, and then will send you an email saying that the application is now closed. And then the next step would be the GMC will send this application to the specialist college or the faculty, whatever you're applying for. For example, if you are in anesthetics, they'll send it to the Royal College of Anesthesia. For the intensive care, they will apply, send it to the Faculty of Intensive Care Medicine. So the role of the GMC here is really, they don't look at the evidence from the clinical point of view. They just from the formality point of view. So they have boxes that they need to tick, make sure that you're putting the right evidence in the right order. The clinical part will be assessed by the college. So the college will have around 49 days to evaluate your application. And then after 49 days, they will return your application back to the GMC, which will have another 40 days to make some basic qualifications, quality assurance of the evaluation. And then they will issue you with a decision based on the Royal College or the faculty recommendation. When the application is sent to the Royal College, they have a specialist equivalent committee which look at people trying to apply through the CESR. So they have 2 or 3 consultants who will be looking into your application and assessing every domain and every point in this application, and then making a decision. And as I said, after 41 days, the GMC will issue a decision and send it back to you whether they have accepted your application or not, or you need, what else do you need to do. So if you look at the whole process between sending the application initially to the GMC and getting a decision, it takes about seven months or 7 months and 10 days plus or minus. It can take less. It's up to seven months. If you look at the whole process, around seven months in total. So how to gather the evidence? So when you are doing the application, how to gather your evidence, how to upload, what documents do you need to upload in your application. So there are 3 main areas to consider: the evidence, the referees, and some administrative details. In terms of the evidence needs to be not more than 5 years. So any evidence you provide more than 5 years will be given much less weight than the most recent evidence. So the CESR assesses your work or your practice only over the last 5 years. You need to make sure that anything over 5 years, they're not going to look into it, or they're not going to give it much weight. And you cannot compensate for any shortfalls in parts of your evidence with experience in a particular area by providing an extra evidence in that. For example, if you are in a surgical specialty and you need to do 500 laparoscopies and 500 open laparotomies, you can't say, oh, I have done 2,000 laparoscopy, so I don't need to send to do the laparotomy. You have to fulfill the 500 in each section, and so in different sections. So you can't say you have done a lot of this and you provide less from the other areas. You have to provide equal number of cases in your as you would do in the as normal UK trainee does in their training. So the evidence is being assessed through the teams for a good medical practice done by the GMC, which is essentially 4 domains. So the first domain is the knowledge, skills, and the performance, and this domain carries most of the evidence. As you can see, 75% of the evidence are in domain 1. Domain 2 is about safety and quality, and that contributes by 20%. Domain 3 is communication, partnership, and teamwork, and that's constitutes about 5%. Domain 4 is about maintaining trust, and between domain 3 and 4, they're both about 5% weight. So domain 1, so what kind of documents do you need to, or evidence do you need to provide in domain 1? All your qualifications, all your assessments and appraisal, records of daily clinical practice, details of all the posts and duties you have been on specialties, like pediatrics, anesthesia, intensive care, cardiac anesthesia, neuro anesthesia, or whatever details in your post, any research, publications, presentations, CPD, medical education, teaching, training. So all these goes under domain 1, which is the knowledge, the skills, and the performance. Domain 2 is about safety and quality, and as I said, that constitutes about 20%. So that includes participation in any audit and service improvement, any response to complaints, any reflections, critical instance or critical instance of forms, any meetings, letters of appreciation, patient feedback. If you have any emails from colleagues discussing a particular patient, if you are involved in any critical instance, what was the outcome? How did you respond to this incident? How do you reflect on that? So all that goes under the domain 2. Domain 3, communication, teamwork, and partnership. Again, communication would include copies of correspondence, for example, trails of emails between yourself and few of your colleagues discussing a patient or referring a patient to another specialty, any teaching feedback. So it's very important when you do a teaching or presentation, you need to ask for feedback, because it will help you to improve, and it would also reflect that you are an active participant in teaching and educating other people. Partnership and teamwork, as I said, MDT involvement. If you're having a multidisciplinary team review of a case or a patient or anything, you need to involve that in your in domain 3. Multi-source feedback. Multi-source feedback, or what we call here in the UK 360 degrees. It's each doctor working in the UK has to do a multi-source feedback once every 5 years, and that means that you're asking people who work with you to send their feedback about you. It can be a different number of people from your colleagues, the trainees, the nurses, any healthcare assistants like physiotherapists, pharmacists, secretaries. So you need to send this form to all these people, and then the feedback will come to your clinical supervisor, and then he will discuss this with you. So you need to include that in your application as well. Any projects you have participated or any, as I said, audit or quality improvement project or management projects, all of that you need to include. Domain 4 is about maintaining trust, acting with honesty, the relationship with the patient, and you can get that from patient feedback, any letters, thank you letters, any incidents that happened that showed that you acted in honesty, you can include that. Any again, any complaints you have responded to. So this is how to fill in this domain. Referees, so you need to identify at least 4 people who worked with you as a referees. You need to notify them in advance. You need to tell them that you are doing CESR and you wanted them to be one of your referees, because it's a long form, and these referees or the consultants, they should mainly cover again the last 5 years. You need to make sure that they are the one who worked with you over the last 5 years. At least 2 of these referee or consultants should be in your equivalent specialty, so should be in your main specialty. Obviously, you would probably include all the 4 or all people in your specialty, but for paper purpose, it just at least 2 should be in your specialty. The first referee must be either your current medical director or equivalent. He not necessarily doesn't need to know you in particular, but he should be able to know the outcome of your unit's work, and would be able to answer kind of some general question about the hospital and how things are done from the management point of view. So you should be able to obtain this information. Each one of these referees will need to write a structured report about your practice, and they should be able to comment on your current competency and breadth of your work experience. As I said, two referees should work in your specialty. The primary referee must be your current either medical or clinical director, preferably the medical director, as they would be able to answer some specific questions that are not available even to yourself or your clinical director sometimes. The admin details, it's again about personal details, primary medical qualification, the postgraduate qualification, and any other relevant qualifications you have. Your work history, professional experience. You need to update your CV to the CESR way. Your registration, licensing history. When you apply your evidence, you need to identify verifier in each hospital or institute you have worked in. So this verifier could be a consultant or any doctor in the hospital who would be able to verify any documents that you are providing from this hospital. You would be able to countersign it and say that this is an original document from this particular institute or the hospital. So there's two things you need to do with the evidence. There's something called authentication and something called verification. So authentication is essentially any registration or qualification obtained from outside the UK needs to be authenticated. Authentication means they need to be authenticated either by the awarding body or a solicitor. So you take the original documents, the solicitor, you'll see the original documents, and then he will do a photocopy and stamp and sign the photocopy saying that this is a true original, this is a true copy of the original, and I have seen the original document. So stamp and sign a copy certifying that we have seen the original. So this is what's meant by authentication. So any documents you obtained outside the UK, they need to be authenticated. Verification is all everything you are providing in your CV needs to be verified, apart from few things which I'll mention later. So as I said, in your institution or hospital, you need to identify a verifier. Then you need to complete a proforma, which is similar to a covering letter saying what type of documents you are providing to verify, how many documents, what form they are in, like PDF, Word, or whatever. And then your verifier will check this evidence, and then it will be, you will submit this evidence with the proforma and the details of the verifier to the GMC. Once the GMC receives this as part of your application, they will conduct what we call primary source verification. So they will contact the verifier and send a sample of the documents that you send to the GMC for him to verify. You say, yes, I've seen these documents from so and so and so, and I can confirm that they are true documents. And so this is what's called primary source verification. In terms of the proforma, you need to match, as I said, you need to match the document description with the title of the document. So if you are providing workplace-based assessment, you need to say how many documents you are providing, how many CBDs, how many multi-source feedback, how many CACs or whatever. You need to add the type of the document, PDF, spreadsheet, Excel. You need also to give specific documents, specific dates and page number. You need to say you're providing 20 documents, and each document is like four pages, covering the period from 1st of November till 2nd of January or 2nd of December, whatever. You need to be very specific. Don't provide more than one proforma per hospital. So you need to provide only all the documents you got from one hospital needs to go under one proforma and one verifier. So you can't provide more than one proforma per hospital. Don't give vague description of the documents. You need to be very clear what documents you are providing. Don't give broad date ranges and collective page numbers. As I said, just be specific. What are the documents that doesn't require verification? Your CV, your 360 multi-source feedback, your CPD, your course certificates, publications in public domain. If you have published something in public, then you don't need to verify it. Any prizes, honors you have got, any letters, reflective diaries, so any reflections you have done on anything, you don't need to verify that. So in terms of the evidence, you have got primary and secondary evidence. Primary evidence includes qualifications, medical reports, logbook, training assessments. The secondary evidence includes 360 testimonials and structural report, and more weight is given, as you can see, to the primary evidence when assessed by the GMC. The success rate of the CESR application ranges between 45 or 46 to 53% throughout the years. As you can see, from 2014 it's about 47%, and in 2020 it was 57%. So why are the applications unsuccessful? There's lots of reasons. One of them is no evidence demonstrating level of competency or performance. So you're not providing enough evidence to support your application. You have not passed the standard test of knowledge. So in each specialty, there will be a test of knowledge. As for anesthetics, it will be FRCA. For surgery, it will be MRCS, for example. So you need to make sure that you have had your standard test of knowledge approved. Insufficient evidence of audit, particularly closing the loop. Closing the loop means that you need to submit a full audit cycle. So you need to audit something and then re-audit and then close the loop. So this is what it means, close the loop. So for example, if you made an audit about, let's say, how to anticoagulate patients is in AF. So you are assessing your practice against the standard anticoagulation in AF. You have found that you are not following the rules in maybe 40% of the patients. So what you do, you change your practice and then you re-audit. And then hopefully when you re-audit this topic, for example, you'll get a better result. So you need to provide the whole audit cycle. So you audited at a point, and then you found that you're not performing well in this, and then you re-audited, and then you found a better or improvement in the response. So you have to provide the whole audit loop. Other reasons would be lack of research. You've not provided enough research. You are super specialized in only one area of the curriculum. You are very specialized in one part of the curriculum, which is sometimes a problem for people who are extremely advanced in their specialty. As I said, other reasons would be lack of management or leadership experience. So when you get your decision, if you are successful, you will be granted the specialist, you will be put on the specialist register, and the GMC will send you a copy of the evaluation. If you are not successful, then you'll have two options. You will either have to apply for a review of your application, or you can appeal. So the review, when you get the decision from the GMC, it will tell you exactly why your application is unsuccessful. So they will tell you, for example, in this domain, you need to provide these types of evidence. So you'll have 12 months to comply with that, and then you can reapply based on this additional evidence that you have provided, and you only need to provide evidence of what the GMC asked for. So you don't need to do anything more than that. So they will tell you specific points that you need to fulfill. For example, do a full audit cycle, do this particular course, do 3 months of anesthesia, 3 months of whatever they ask for. So if you do that, and then you'll have 12 months to do whatever they ask for, and then you can reapply based on that. Or the other option, you can appeal. If you think that the decision made by the GMC is not fair, the review application costs about £728. If you appeal it, the cost would between 1,600 to 2,500 pounds, depending on if you are appealing in person. Sometimes you can appeal in person, which is more expensive. You go in front of the panel and say why you think that the decision is not fair, or you can appeal by post. So this is why the difference in the cost of the appeal. If you look at the review application, the success rate is very high, and it has been very encouraging. So 70% of the candidates who apply for a review application, they got granted the CESR. Up to in 2020, 96%. So almost 96% of people who applied for a review of application in last year, they have been successful in their application. So this is quite encouraging. So the quick tips for the application, as I said, you need to make sure that you verify and anonymize your evidence. You need to submit evidence of your eligibility as in primary and as specialist medical qualification. You need to familiarize yourself with the curriculum and what your application is assessed against. It's very important. You need to read the curriculum properly and map it to your training. You need to read the specialist specific guidance on the GMC website. It's got very detailed information about the specialty you're applying in. Don't apply too early. Make sure you have got enough time to gather the evidence before you submit your application. And gather your evidence prospectively when you can. So if you decide that you want to go down the CESR route, then as you go through your training, make sure that you gather all the evidence. Anything you do, make sure that you've got it documented and save it on your computer and to be able to upload it later on. Make sure again your CV meets the guidance. Don't duplicate your evidence. You should cross-reference instead. You need to choose your referee carefully. The referee also plays an important role in the application because this is the GMC will ask them, what do you think of this particular letter? How is performance? So you need to make sure that your referee will support you in that application. You need to go and speak to them, and they will be very frank. Some of them will say, no, I'm not happy to maybe put his name as a referee, and that's fine. But you should be able to know from your practice or from your experience, who would you go for from the consultant you work with. You need to listen to your GMC specific advisor. They're quite experienced, that they want to help you with your application. So you need to listen to what they are saying. So in summary, the CESR is one of the routes to get onto the GMC specialist register to be able to practice as a consultant. It is applicable mainly to people who have good experience in their home country, or people who hasn't been in a UK training program. Also, some people have been applying to it who has been in the UK training program at some point and they left the training program. So some of them go down the CESR route. You definitely had a better chance of a successful application if you are already working in the UK, because lots of components of this application, if you're not having this idea of or concept of that medical practice in your home country, you find it a bit challenging to try and provide that. But it has been evident few specialties have had their CESR done outside the UK, so it's not impossible, but it is a bit more difficult. You need to try and match your training back home with the curriculum of whatever you are applying for, and try and fill in the gaps in your training essentially. So you have got experience in specialty, you have done stuff back home, and you can just you fill in the gaps in what you have left. You need to be clear what you need and ask for help and support from the trust you're working in or the institution. Choose your referee carefully. Don't apply too early, but again, don't wait too long. Thank you.
Perfect. So thanks so much, Dr. Ahmed, and very good effort actually, and very long and comprehensive CESR pathway.